psychological, psychological and mood change activities. Gynecologist always hello.
Hello,
Gynecologists are uh,
just one slide.
don't change slide, sir, please.
Okay.
Gynecologist always trying to handle them without using a drug, because any drugs have form of chemical can affect growth and development of fetus. Many congenital disorders are the result of use of various type of drugs such as acromelia, phocomelia, etc., used in pregnancy. To avoid such conditions, gynecologists are always trying to minimize the use of drugs during pregnancy. During pregnancy, various factors influence the health and well-being of both mother and the developing fetus. One such factor that has gained significant attention is the impact of music. Music, with its rhythmic patterns and emotional tones, has been suggested to affect the psychological, physiological states of pregnant women and potentially influence fetal development. Procedure for music therapy into pregnancy. Basically, we have to go on consultation with a music therapist, selection of suitable music, creation of a personalized playlist, listening sessions, mindful listenings, bonding activities, uh, reflection and journaling, continued support. Basically, what is bonding activities? Three things are very essential. The first one is selection of suitable music. We have to identify music, just like the choice of mother is a main factor. Second one is listening session. We have to apply music on patients or antenatal mother. The last one is bonding activities. If mother are connected with the particular song, with particular ragas, with particular music, so fetus definitely will work with it. Please change slide, sir. Objective of my study. Aim of this workshop is that a common man can use the pleasant sound for during pregnancy or plan for a child. Is it working? Music will helpful for a plan of a child. Is this helpful? One question in my mind, or anybody can ask this: music will work on fertility? Yes, this is. Pleasant sound help in the pregnancy by emotions regulation, relaxation, pain management, anxiety, stress of mother. Music also help in parturition and facilitate the child's growth and development. Music will be very helpful to control pregnancy mood swing and pain management. Impact. If I'm talking about impact, so what is the basic impact of music? तो अगर मैं एंटीनेटल मदर हूं या फिटस, आपके बाहरी जो आवाजें हैं वो सुन सकता है. यस, दिस इज, यू ऑल नो फ्रॉम महाभारत के जो गर्भ संस्कार होते हैं बेसिकली, तो जो फीटल है वो मदर की बाहर की एक्टिविटीज भी एट द 20 वीक्स योर बेबी हियर्स द देयर फर्स्ट साउंड. मतलब बेबी के जो फीटस के और ऑर्गन्स होते हैं, हियरिंग कैपेसिटी होती है, वो 9 वीक पर स्टार्ट हो जाती है बेसिकली. उसके अलावा ऑन 20 वीक्स ऑफ गेस्टेशनल एज fetus can move towards sound. Fetal memories start to develop at 30 weeks. According our Indian mythologies, either Hindu mythologies or Muslim mythologies, तो जो फीटल एक्टिविटीज हैं वो विया गर्भ संस्कार या रिसाइटेशन ऑफ यासीन शरीफ इन मुस्लिम कल्चर और अदर सूराज एट ऑल. तो जो ये सूराज हैं या फिर बेसिकली रिसाइटेशंस हैं, वो फीटल जो डेवलपमेंट है उसे इम्पैक्ट करती है पूरी तरह से. एंड द वीक 30 of gestational age, fetal start memories. फीटल की जो मेमोरीज हैं वो डेवलप होने लगती हैं, और वो जो उसका मेमोरीज वाला सिस्टम है वो डेवलप्ड हो जाता है बेसिकली. जैसे हम बात करें कि फीटल बेसिकली अपनी मदर को, फीटस बेसिकली अपनी मदर को सुन सकता है. यानी एट द अर्ली एज ऑफ बर्थ, अगर फीटल क्राई है, क्राई मूवमेंट है उसके, या वो परेशान है, तो बेसिकली वो अपनी मदर से किसनी कनेक्टेड होता है, क्योंकि जो उसकी मेमोरीज हैं वो प्री में डेवलप्ड हैं मदर की वॉइस सुनने के टुवर्ड्स. ओके, नाउ आई एम टॉकिंग अबाउट इम्पैक्ट. म्यूजिक इंक्रीज द अनबॉर्न चाइल्ड्स heartbeat, movement, sound, stimulations, enhances the brain's maturation. The Mozart effect boosts creativity and cognitive skills. And in utero listening to lullabies improve postnatal sleeping habits. We can evaluate the impact of music therapy on cardiac activity parameters of fetus and movement of fetus through abdominal ultrasonography in antenatal through different type of music: pop, classical, folk, instrumental, Punjabi, religious, etc. When baby here in womb, 9 weeks here began to develop. 16 weeks, some sounds are detected. At the 24 week, the HPA, hypothalamic pituitary adrenal HPA, axis is a stress system in children that can impact their neurodevelopment. Basically, we are working on therapeutic impact of music. We are working on therapeutic impact of music. What is therapeutic? If I'm talking about music, so what is therapeutic basically? Am I audible?
Yes, ma'am.
Okay. Basically, sound have measurement unit known as decibel. Okay. So if I'm going for below 50 decibel, it will count as therapeutic. If I'm going for higher than 50 decibel, so excuse me, sir, please go for previous slide, previous one. Thank you. So I'm just talking about noise. Noise can affect the children. Noise can increase or decrease cortisol level. Noise affect करती है on the mother's HPA axis leading to elevate cortisol level. Basically, फीटल को जितनी मेमोरीज जाती हैं, या जितना भी फूड है या न्यूट्रिएंट्स हैं, जितना भी जाएगा वो विया प्लेजेंटा जाता है. बिकॉज फीटल कनेक्टिविटी जो होती है विया प्लेजेंटा होती है, तो प्लेजेंटा गेट्स ओवरलोड एंड ट्रांसफर कोर्टिसोल टू द फीटस. ओके, अब इफ आई एम टॉकिंग अबाउट हाई कोर्टिसोल लेवल, तो अगर हम बहुत ज्यादा नॉइज देते हैं, यहाँ हमारे जो थेराप्यूटिक वैल्यूज हैं, अगर थेराप्यूटिक वैल्यूज इम्पैक्ट होती हैं, तो दिस विल वर्क वर्स. Just like constant high level of cortisol lead to restriction in fetal growth. So please change slide. The next one. If I'm talking about methodology, firstly, you have to, being a layman, you have to explain the procedure to mother. Need a written consent from prior to musical treatment. If you are working with your just like if you are working with your uh, uh, siblings, or with with within your home, if you are providing a treatment, so you don't need to take any kind of consent form. If you are working on outside, you have selected to volunteer, so you have to fill consent form prior for ethical issues at all. Two headphones, wireless headphones having frequency adjuster, sound meter, and Android phone. One headphone was placed on abdomen, womb of mother, and another of the ear of mother. You have to make sure both headphones, so both headphones have connected with one device only, so you can control the voice of music. To control the sound frequency, which a third headphone is used by instructor, all the three headphones working through a single point. Selected spiritual and other sounds are given to mother and fetus through headphones. Music used during study are selected based on DCS theory of neuroendocrine stimulations. Heartbeat movement are observed through USG machine and ECG of fetus. Mother must fill a questionnaire to know the mother response for music therapy. Music therapy provided in following steps. Just like selection of music based on questionnaire, considering mother choice with frequency and tone, providing specific music to mother and fetus, three headphone with sense of fetus, mother, mentor, pre-post analysis of 2 to 3 set of music, impact of music after birth on fetus. Music therapy during pregnancy of numerous benefits of expecting mother and her developing fetus. The first one is stress reduction. Stress is a major problem during pregnancy because we are facing lot of changes in our psychological way, in our physical way, body shaming, etc. Bonding and connection, pain management, promotion of fetal development, regulation of maternal health, heart rate and blood pressure, reduction of pregnancy related symptoms, preparation for labor and childbirth, postpartum recovery. This is also very important task. Some ragas here, just like mood, Darbari Kannada, Jaijawati Kedar Sohani. BP for BP and hypertension, Ahir Bhairav, Bhim Palasi, Kaushi Kannada. Insomnia, Bhageshri, Khamaj. Pain sedative, for pain sedative, Darbari Rag. My study and my own experiences. Music can used for child rotation also. Relax, relaxing piano music for baby move inside the womb, brain development. Basically, I'm going for result. In most of the cases, heartbeat and movement of fetus increase significantly by music therapy. Variation of heartbeat depend on different type of music. Fetus respond highly to chants, ghazal, hip hop music. Fetal with fetus with work with mother choice. If mother loves just like if mother love ghazal, if mother feel calm during the ghazal session, so fetal will work with it. Music therapy increase heart rate of fetus 5 to 27 bpm. It depend on the nature of fetus. 8 to 9 week fetus also realize the rhythm of music. uh, Graph showing relationship between mother age, first line from pregnancy, second line from bottom, and heartbeat. You can see the positive correlation between mother age, pregnancy week, and sound therapy. Some ultrasonography reports significant findings. Fetus moved faster during hip hop and romantic songs, which reflects that fetus enjoying it. Increased blood pressure and fast breath of fetus showed during hip hop music. Slow piece music leads to lower heart rate comparison to their baseline values. The soft spiritual song with low rhythm are perfect for fetus or infants. The increase in bicycling movement observed during hip hop and stepping movement. Increased in spiritual Music positively impact the health of adults or infant, but pain or stress during pregnancy have decreased few point by music therapy. That mean music decrease the level of stress during pregnancy, which result to control the pregnancy mood swings of the mother. The mother voice and reaction is one of the most important sensual stimuli for the fetus. Music also help to overcome delivery pain through DCS theory of neuroendocrine stimulations. Conclusion. The impact of music during pregnancy on both mother and fetus is a subject of growing interest and research. While music has the potential to positively influence maternal well being, fetal development, and the bonding process, further studies are needed to elucidate the specific mechanism and long term effects. Nevertheless, incorporating music into prenatal care, when done safely and appropriately, can be a valuable tool for promoting a healthy and positive pregnancy experience. Specific spiritual music is very effective and suggested to use it as a can. Thanks. Any question?
Any question?
Ma'am, actually, what type of questions are used in preparing the questionnaire, ma'am? For example, ma'am, actually, as recently I mentioned that I am doing my PhD and I'm doing my project on post-cesarean mothers in alleviating pain and stress, ma'am. So
Mhm.
coming to this concept, like what type of questions can I use as a questionnaire related to music therapy, ma'am?
Okay. You have to ask mother choice first. What she want to
Yes.
listen. And after that, you have to work on it. Means, as sir told you before, that you have to select rag.
Yes, ma'am.
99.9 songs are related to ragas. Each
Okay.
each in every songs use ragas. Many time it
Mm.
happens in one song only. You can see that 2 to 3 ragas are used. So you have to go first for the patient choice, and after that you have to correlate some other questions also, just like dietary habits, just like pain or other medical condition of mother. After that you have to use music as a therapy.
And if you want to identify that music is impacting or not on particular,
Yes.
you have to select some psychological tests which are available in market, and we can also prescribe that pre and post. First, we are
Okay, sir.
before starting the therapy, and then after the therapy. And one more thing, if you are doing a PhD, you have to
Yes, sir.
restrict yourself up to some raga. If you are in case
Okay.
not use too many ragas, select ragas
Okay.
which are suitable. You can consult with the particular person and
Okay, sir.
identify the misera and identify the raga, and then continue go for the study. If you are
Okay,
select
sir.
too much ragas, will get you confused. Okay, that is it.
Okay, sir. Okay. So, coming to the pain management scale, as if we use visual analog scale, that is a common universal scale, no, sir. We are using for assessing the pain. Like when music is related to this, like what type of assessment additionally are related to implement in this, sir?
What is you told that what is pain? Pain is
Yes,
a
sir.
psychological condition basically.
Yes, sir.
Uh, you cannot measure, you cannot identify, yeah, or you can pain cannot be quantify to measure it. So
Yes, sir.
for identification of pain, just psychological tests are better, because there are many type
Okay.
of psychological tests you can
Yes.
conduct uh,
Mm.
for pain identification to increase working efficiency. Uh,
Okay.
there are a lot of specific psychological tests. So you cannot quantify the pain, but you, on the
Okay.
basis of psychological analysis, you can compare that yes, patient feeling, patient condition improve or not.
Okay, sir. Okay.
uh, Ovia, you wanted to ask anything?
Yes, ma'am. So the presentation you did, is this a dissertation or it's just a seminar type of thing? Like, did you do a personal research? Is this your personal work?
Yes.
Okay. So how did you like did you get a feedback, or like how many sessions did you take it to achieve the results? Can you give me more insight on that? Like how did you track the moments, or like did you get a feedback from somebody? Like how many people did you work on? Is there
Okay.
anything like
In pregnancy, I had worked on 28 females, and no, 29 female. One was pregnant with twins, and 28 was pregnant with a single fetus. Okay, so I had conduct 2 to 3 sessions on it, and I bifurcate my session on first semester, second trimester, and third trimester. So I worked on trimesters basically. So firstly I have to take we have to take consent form of volunteer, and after that we have to proceed for therapy. Being a technician or being a researcher, this is our basic responsibility that we have to um, this is our basic responsibility that we have to cool down the patient. We have to ask more questions about her health, her mental conditions at all. After 3 sessions we have to go for result.
3 sessions is enough? Okay.
Yeah, 3 sessions on each. We
Per
have to go on
trimester.
first semester, second trimester, and then after third trimester.
Okay. That's a pretty good
uh,
job.
yeah. I saw I think in 4 cases that doctor prescribed earlier that she have to give birth via C-section delivery. After my session, after therapy, uh, women gave birth naturally.
That's
Sure.
very good. That's nice.
Nice.
So it was just a ragas only. You didn't use any like did you have pre-recorded things that they have to listen at home, or was the 3 sessions enough for them?
Sorry, I'm unable to understand.
So were the 3 sessions enough for them, or like did you recommend to hear music at home, like listen to this
At home also.
also? Okay. So okay.
The session was to see the fetal activity during ultrasonography and heartbeat of fetus,
Okay.
movement and heartbeat also.
Okay, great.
Excuse me, ma'am.
Yeah, please.
Ma'am, if in case of post-cesarean mothers,
Hmm.
if you want to give music therapy,
Yes.
means the post-cesarean mothers are already hospitalized
Sorry,
and
mother.
mostly hospitalized because of surgery. They will be in hospitalization, no, ma'am.
You
The
can
patient.
In case of cesarean delivery, you are asking the question
Yes,
about
sir.
cesarean delivery. That after
Yes, sir.
cesarean, the mother are also in hospital. Yeah. So continue with the
Yes,
question.
sir. Yeah. How for from what day to from which day to how many days we can give the session, sir? As previously, sir has answered that the cycles can be for 2 to 3 days per day. Cycles can be used
Mhm.
for 15 to 20 minutes of duration.
Yeah.
For in case of post-cesarean mothers, as they are hospitalized because of the surgery process, nearly approximately 5 to 7 days, the person will be admitted. The mother will be admitted. Later on, mother gets discharged. So only a 5 day session of music therapy is relevant, or we have to ask them to continue even after going to home also, ma'am,
You
for better outcome.
after going home also, because postnatal care is also very essential. Just like
Yes, sir.
postpartum is a very difficult phase to a newborn mother, just like she have to face various psychological and physiological change, as you know, in our body. So
Okay.
the session will take around one month at least.
Okay. Okay, ma'am. So the course
Depend on
must
the
be
mother
for 1
condition,
month.
or depend on the
That is
mother
what.
condition, her mental strength, etc.
Yes, ma'am. Usually the not only the cesarean mothers, even the postpartum phase is for
Yeah.
6 months to 1 year. So definitely 1 month of session will be good if even after getting discharged, if the mother is taking. So she will be having a good balance in her postnatal part of as a mother
Yeah,
for
exactly.
the period.
Postnatal is very difficult in comparison to prenatal.
Yes, ma'am. Yes. Okay, ma'am. Thank you, ma'am.
Good,
Thank
thank
you.
you. Any other question?
Anything else?
No.
Okay, thank you. So